here in Cincinnati, Ohio, talking with Dr. Keith Melvin, who I have asked to be drafted as the Surgeon General of the No Sodium Soldiers, the No-So-So, that is spreading all over the country, but starting here in Cincinnati. Now, I've known Dr. Melvin for many, many years, but Dr. Melvin, if you would, give us your practice, your background, so our friends around the country and the world will have more information of you as a physician.
I'm Dr. Keith Melvin, practicing internal medicine in Cincinnati for the past 27 years. Trained at the University of Cincinnati College of Medicine and did internal medicine training at Jewish Hospital here in Cincinnati. Have lectured extensively on hypertension and diabetes and the metabolic syndrome around the country through many, many hospitals, and do a lot of work here in Cincinnati. I've had several radio shows and been involved in community activists to try to reduce the cardiovascular morbidity and mortality here in the Cincinnati area.
Dr. Melvin, please tell our listeners what sodium is, what salt is, and you mentioned some time ago the word renal. Many people may not be familiar with the word renal. Is it also a technical term for kidneys?
Yes. Right. The renal disease is kidney disease. Cerebrovascular disease is brain disease, and cardiovascular disease is heart disease. Sodium is an ionic substance that we find in our foods. Certainly it is a preservative. And of course, when we see it, we see sodium chloride. That's what we call salt. That's what is in the shaker on the table, and that's what we are shaking on our foods. But sodium itself is the product that is our problem. And sodium can be found in a variety of different substances. Certainly if you look on the back of a can or candy or anything, you'll see that the things are sodium preservatives that are in these products. We must reduce the amount of sodium that we're taking. It's not just salt per se, it is sodium that is the enemy.
Now, Dr. Melvin, the main mission of the No Sodium Soldiers is to heighten the awareness of the types of things you're talking about. And to do so, we're going to have a campaign, a part of the No Sodium Soldiers, that deals with not how's your golf game or not how's your basketball game, but how's your sodium. And many of us, when we started soldiers greeting ourselves, we'll be greeting each other, hey brother, how's your sodium? And we'll start talking about it more and more, and we will be bringing it down among us all. Now I want to welcome you as a Surgeon General of the No-So Soldiers, the No Sodium Soldiers. Let me know if you can accept that banner. I know you have earned it by your right and through your work, but as a brother of mine for many, many years, God gave me in the middle of my sleep to make you that Surgeon General. That's why I called you and let you know that I wanted to come over and see you today, because I know from all of your work around the country and your knowledge here in Cincinnati, there's not a better person than you to spearhead that, and other doctors, of course, will be a part as well.
Well, you know, Judge, I accept that honor, I accept the challenge, and I've been motivated by you today, and certainly we want to make sure that we send the word to everybody who is within listening distance or in sight of a vision that you have. And let's make sure that we get people on board to make sure they reduce the amount of sodium and salt that they're shaking on their food.
Yes, and remember, the salt shakers are kids that are saying, Daddy, shake the salt. In other words, get rid of that habit. Shake that habit. Get rid of that habit. Don't shake it on your food, but shake it and get rid of it. Get rid of it. Just like you shake a bad habit, you shake that bad habit, you throw it off, get rid of it. That's what the young people are going to tell grandma, grandpa. Shake that salt, get rid of it, because the adults will be No Sodium Soldiers.